Hello everyone. Thank you for joining us today. I'm Che-Wei Lin, an associate professor in the Department of Biomedical Engineering at National Cheng Kung University. Today, I'm delighted to present our research on a cutting-edge rehabilitation system designed for stroke patients. We call it VRMT-RT, which stands for Virtual Reality Mirror Therapy with Rhythmic Training and Vibration Stimulation. This innovative system merges the proven benefits of mirror therapy with the immersive and engaging nature of virtual reality. Moreover, we've integrated rhythmic music and vibration stimulation to further amplify the therapeutic impact. In the next, I'll delve into the background of this technology, elaborate on the system design, share our key research findings, and explore the potential of VRMT-RT to transform the lives of stroke patients. Let's move on to the highlights of our research. First and foremost, we successfully developed a virtual reality mirror therapy system with rhythmic training and vibration stimulation, or VRMT-RT, specifically designed for upper limb rehabilitation. To evaluate the efficacy of VRMT-RT, we conducted a study with two groups of participants, hemiplegia patients and young, healthy individuals. Our findings were quite remarkable. In hemiplegia patients, the VRMT-RT group demonstrated significantly greater improvement compared to the conventional mirror therapy group. Furthermore, in young participants, we observed that incorporating music and vibration led to increased activation of the motor cortex and more effective improvement in hand function. These results strongly suggest that VRMT-RT has the potential to revolutionize upper limb rehabilitation for stroke patients. To understand the motivation behind our research, let's first delve into the background. Stroke is a leading cause of disability worldwide, and hemiplegia, or paralysis of one side of the body, is one of its most common consequences. Effective rehabilitation is crucial for stroke patients to regain motor function and improve their quality of life. Research has shown that multisensory integration techniques, which engage multiple senses simultaneously, can significantly enhance upper limb training benefits. Traditional mirror therapy has been used in stroke rehabilitation for some time. It utilizes a mirror to create a visual illusion of movement in the affected limb, which can help activate the mirror neuron system and promote motor recovery. However, conventional mirror therapy has limitations, as it typically allows for only small movements. Music therapy has also been explored in stroke rehabilitation. It has been shown to reduce anxiety and enhance cognitive function in patients. However, music therapy alone often lacks direct effects on motor function recovery, especially without accompanying movement. Considering these factors, we set out to develop a system that combines the benefits of mirror therapy and music therapy while addressing their limitations. This led us to the creation of VRMT-RT. So, what motivated us to develop VRMT-RT? As we've discussed, mirror therapy and music therapy each offer unique benefits for stroke rehabilitation. Mirror therapy, with its visual illusions, can effectively promote motor recovery. Music therapy, on the other hand, provides valuable psychological support by reducing anxiety and enhancing cognitive function. However, both therapies have limitations when used alone. Mirror therapy is often restricted to small movements, while music therapy may not directly improve motor function. This is where virtual reality comes in. VR allows us to create a dynamic, multisensory environment that integrates visual feedback, auditory stimulation, and even tactile cues. By combining the strengths of mirror therapy and music therapy within a virtual reality framework, we aim to develop a more comprehensive and effective rehabilitation system. This is the core motivation behind VRMT-RT. Now, let's take a look at the existing literature to understand the foundation of our research. This table presents a summary of relevant studies that have explored the effects of mirror therapy, music therapy, and their combination with other techniques. As you can see, several studies have investigated the benefits of mirror therapy for stroke patients. Bay et al. 2012, for instance, found that mirror therapy led to changes in brain activity, specifically in the mu rhythm, which is associated with motor function. Similarly, Alton-Muller et al. 2009 demonstrated the positive effects of music therapy on motor recovery and brain activity in stroke patients. They observed increased beta coherence, indicating enhanced communication between different brain regions. More recent studies have explored the combination of mirror therapy or music therapy with vibration. Ding et al. 2019 and Shu et al. 2021 found that adding vibration further enhanced the effects of these therapies on brain activity and motor function. Our own research, Lin et al. 2021, focused on combining mirror therapy with virtual reality. We observed that this combination led to greater improvements in motor function compared to conventional mirror therapy. Finally, Bay et al. 2023 investigated the effects of combining music therapy with virtual reality and found significant cortical activation, suggesting that this approach can effectively stimulate the brain. These findings from the literature provide strong support for the development of VRMT-RT, which integrates mirror therapy, music therapy, and virtual reality to maximize therapeutic benefits. Now, let's dive into the system architecture of VRMT-RT. This diagram provides a comprehensive overview of the various components and how they work together to create a seamless and effective rehabilitation experience. At the heart of the system is the user, who interacts with VRMT-RT through a Meta Quest 2 headset and controllers. The control system manages the virtual environment and delivers multisensory feedback to the user. This includes auditory feedback in the form of rhythmic music, haptic feedback through vibration stimulation, and visual feedback through the immersive VR display. The user interface, displayed within the VR environment, provides a user-friendly way to navigate the system and control various aspects of the therapy session. To monitor brain activity during the therapy, we integrated an EEG monitoring system. This system uses an electrocap to capture brain waves, which are then recorded and analyzed using an open BCI site and board. This combination of advanced technologies allows VRMT-RT to provide a personalized and engaging rehabilitation experience while also capturing valuable data on brain activity. Let's now delve into the methods we employed to develop VRMT-RT. This diagram outlines the key steps involved in creating the system, from audio processing and VR environment design to data collection and storage. We started by carefully processing the audio elements. This involved loading music files, separating the drum sounds to create rhythmic cues, normalizing the audio, and extracting rhythmic patterns. Next, we designed the VR environment and interactions using Unity and C#. We utilized the XR Interaction Toolkit to track hand movements, calculated positions to generate the mirror reflection, and created a rhythmic target hitting system. To create the virtual environment, we used Blender to model 3D components and then exported them to Unity. Finally, we implemented a data collection system using Google Apps Script to retrieve performance data from Unity and store it in Google Sheets. This meticulous development process ensured that VRMT-RT provides a high-quality, engaging, and data-driven rehabilitation experience. This is the demo video of our system. Now, let's examine the results of our study with hemiplegia patients. This slide presents the key findings from our evaluation, comparing the VRMT-RT group to the traditional mirror therapy group. We observed significant differences between the two groups in the Fugl-Meyer Motor Assessment, or FMA. Specifically, the VRMT-RT group showed significantly greater improvement in the shoulder subscale and the FMA total score. This indicates that VRMT-RT led to more substantial improvements in both shoulder-specific and overall motor function compared to conventional mirror therapy. While there was no statistically significant difference in the clinical global impression scores, the data suggests that VRMT-RT still had a positive impact on the patient's overall recovery. These findings provide compelling evidence that VRMT-RT is a more effective approach for upper limb rehabilitation in hemiplegia patients. In addition to our study with hemiplegia patients, we also conducted research with young, healthy participants to further investigate the effects of VRMT-RT. This slide presents the key findings from this group. We observed significant improvements in the FUA hand dexterity test scores after the sequential introduction of music and vibration stimulation. This suggests that these elements enhance the effectiveness of VRMT-RT in improving hand coordination and motor skills. Furthermore, our EEG analysis revealed a clear suppression of the mu wave, indicating activation of the motor cortex. This effect became even more pronounced with the addition of music and vibration, suggesting increased brain activity related to motor control. We also examined peak pinch force and described the findings related to pinch force, if available. The ERD scalp map provides a visual representation of the brain activity during the peak pinch force task, highlighting the areas involved in this movement. Finally, our analysis of brainwave coherence described the findings related to coherence, if available. These findings from young, healthy participants provide further evidence that VRMT-RT, particularly with the addition of music and vibration, effectively activates the motor cortex and enhances hand function. Let's now move on to the discussion and conclusions of our research. In our study with hemiplegia patients, we found that VRMT-RT significantly improved hand function, as measured by the FMAUE total score. This improvement was greater than that observed with traditional mirror therapy, demonstrating the potential of VRMT-RT to enhance upper limb recovery in stroke patients. Our findings from the young, healthy participants further support the benefits of VRMT-RT. We observed significant improvements in fewest scores from baseline, with even greater gains when music and vibration were incorporated. Moreover, EEG analysis revealed enhanced ERD, indicating increased motor cortex activation, particularly with the addition of music and vibration. This suggests that these elements play a crucial role in promoting brain plasticity and motor learning. Taken together, our findings demonstrate that the virtual reality mirror therapy system, combining rhythmic music and vibration stimulation, has a positive impact on stroke rehabilitation. It effectively supports brain activation and enhances motor function, particularly with the added benefits of music and vibration. We believe that VRMT-RT holds great promise as a novel and effective approach for upper limb rehabilitation in stroke patients. To thoroughly evaluate the effects of VRMT-RT, we employed a comprehensive set of evaluation tools. This slide outlines the various assessments we used to measure hand function and analyze brain activity. For hand function examination, we utilized a combination of clinical tests, including the pinch holding up activity, finger pinch manipulation, Purdue pegboard test, Sims-Weinstein monofilament, Minnesota manual dexterity test, and two-point discrimination. These tests allowed us to assess various aspects of hand function, such as pinch strength, fine motor skills, gross movements, tactile sensation, and sensory acuity. In addition to these clinical assessments, we also analyzed EEG signals to understand the neural mechanisms underlying the observed improvements. We focused on mu and beta ERD, which reflect the activation of the mirror neuron system, motor cortex, and wider brain networks. Furthermore, we examined channel coherence to assess interhemispheric imbalance and connectivity among different brain regions. By combining these diverse evaluation tools, we were able to gain a comprehensive understanding of the effects of VRMT-RT on both hand function and brain activity. To analyze the EEG data collected during our VRMT-RT experiments, we employed a robust EEG analysis method. This slide outlines the key steps involved in processing and analyzing the brainwave data. We started by preprocessing the raw EEG data. This involved applying a bandpass filter to focus on the relevant frequency range, using artifact subspace reconstruction to remove noise in artifacts, and performing independent component analysis to separate different brain activity sources. We then calculated changes in power spectral density using the Puelch function and coherence changes using the Mscohere function. These analyses allowed us to quantify changes in brain activity and connectivity associated with VRMT-RT and the different stimulation conditions. To assess event-related desynchronization, or ERD, we calculated the changes in power spectral density between a baseline period and a task period. This provided insights into how brain activity changed in response to the VRMT-RT tasks. To investigate coherence changes, we computed pairwise coherence between all EEG channels, allowing us to assess the level of synchronization and connectivity between different brain regions. Finally, we visualized the results using various techniques to gain a clear understanding of the effects of VRMT-RT on brain activity. This slide details the experiment design for our research. Before we began, our study protocol was reviewed and approved by the National Cheng Kung University Hospital Institutional Review Board. We conducted experiments with two groups of participants, 36 hemiplegia patients and 30 young, healthy individuals. As you can see in Section A, the hemiplegia patients were divided into two groups, a conventional mirror therapy group and a VRMT-RT group. Both groups also received usual care. Section B shows the design for the young, healthy participants. This was a crossover trial where each participant experienced 3 different VRMT-RT conditions, without music, standard, and with enhanced vibration. We incorporated washout periods between each condition to minimize carryover effects. Finally, we used a range of assessments to evaluate the impact of VRMT-RT on hand function and brain activity. The specific assessments used for each group are listed at the bottom of their respective sections. This rigorous experimental design allowed us to systematically investigate the effects of VRMT-RT and its various components. Let's begin by highlighting the key takeaways from our research. Firstly, we successfully developed VRMT-RT, a virtual reality mirror therapy system with rhythmic training and vibration stimulation, designed specifically for upper limb rehabilitation. To evaluate its efficacy, we conducted a study involving two groups, hemiplegia patients and young, healthy individuals. Our findings were very encouraging. In hemiplegia patients, the VRMT-RT group showed significantly greater improvement compared to those receiving conventional mirror therapy. Moreover, in young participants, incorporating music and vibration led to significant differences in the FUA hand function test. EEG measurements further revealed activation in the motor cortex. These results strongly indicate that VRMT-RT has the potential to be a groundbreaking tool for upper limb rehabilitation in stroke patients. Let's move on to the results of our study with young, healthy participants. This slide presents the key findings from this group, focusing on how VRMT-RT influenced their hand function and brain activity. Firstly, we observed significant improvements in the FUA hand dexterity test scores after the introduction of music and vibration stimulation. This suggests that these elements enhance the effectiveness of VRMT-RT in improving hand coordination and motor skills. Secondly, our EEG analysis revealed a clear suppression of the mu wave, indicating activation of the motor cortex. This suppression became even more pronounced with the addition of music and vibration, suggesting increased brain activity related to motor control. We also examined peak pinch force and described the findings related to pinch force, if available. The ERD scalp map provides a visual representation of the brain activity during the peak pinch force task, highlighting the areas involved in this movement. Finally, our analysis of brainwave coherence described the findings related to coherence, if available. These findings from young, healthy participants provide further evidence that VRMT-RT, particularly with the addition of music and vibration, effectively activates the motor cortex and enhances hand function. Let's now move on to the discussion and conclusions of our research. In our study with hemiplegia patients, we found that VRMT-RT significantly improved hand function, as measured by the FMAUE total score. This improvement was greater than that observed with traditional mirror therapy, demonstrating the potential of VRMT-RT to enhance upper limb recovery in stroke patients. Our findings from the young, healthy participants further support the benefits of VRMT-RT. We observed significant improvements in FUA scores from baseline, with even greater gains when music and vibration were incorporated. Moreover, EEG analysis revealed enhanced ERD, indicating increased motor cortex activation, particularly with the addition of music and vibration. This suggests that these elements play a crucial role in promoting brain plasticity and motor learning. Taken together, our findings demonstrate that the virtual reality mirror therapy system, combining rhythmic music and vibration stimulation, has a positive impact on stroke rehabilitation. It effectively supports brain activation and enhances motor function, particularly with the added benefits of music and vibration. We believe that VRMT-RT holds great promise as a novel and effective approach for upper limb rehabilitation in stroke patients. Let's now move on to the discussion and conclusions of our research. In our study with hemiplegia patients, we found that VRMT-RT significantly improved hand function, as measured by the FMAUE total score. This improvement was greater than that observed with traditional mirror therapy, demonstrating the potential of VRMT-RT to enhance upper limb recovery in stroke patients. Our findings from the young, healthy participants further support the benefits of VRMT-RT. We observed significant improvements in FUA scores from baseline, with even greater gains when music and vibration were incorporated. Moreover, EEG analysis revealed enhanced ERD, indicating increased motor cortex activation, particularly with the addition of music and vibration. This suggests that these elements play a crucial role in promoting brain plasticity and motor learning. Taken together, our findings demonstrate that the virtual reality mirror therapy system, combining rhythmic music and vibration stimulation, has a positive impact on stroke rehabilitation. It effectively supports brain activation and enhances motor function, particularly with the added benefits of music and vibration. We believe that VRMT-RT holds great promise as a novel and effective approach for upper limb rehabilitation in stroke patients. Thank you for your attention. I hope you found this presentation informative and engaging. Before we conclude, let me briefly recap the key takeaways from our research on VRMT-RT. VRMT-RT is an innovative system that combines virtual reality, mirror therapy, rhythmic music, and vibration stimulation to enhance upper limb rehabilitation in stroke patients. Our research has shown that VRMT-RT can significantly improve hand function and brain activity in individuals with hemiplegia. We believe that VRMT-RT holds great promise as a valuable tool for stroke rehabilitation, and we are excited to continue exploring its potential benefits. Thank you again for your time and interest in our work. We are happy to answer any questions you may have.